Welcome. It's been a little bit since we've had a combined call. For those of you that don't know me, I'm Caroline McKinney. I'm the Nutrition Innovation Director at the Nutrition Aging Resource Center. So glad that you've joined us here today. So now to the good stuff. So I'll turn the floor over to Bambi Press, Healthy Aging Director with the Nutrition Aging Resource Center and Iowa Department on Health and Human Services for our technology panel. Thanks, Bambi.
Wonderful. Thank you so much, Caroline. And I'm really thrilled to have this conversation today. I think there's so much interest around this topic. It just felt like a really great opportunity to kind of bring this group together. So when I think about technology, what comes to mind, if you're around in the 90s, you might remember a Four Non Blondes album by this name, but bigger, better, faster, more. Just really talking about it in terms of what technology means for the constantly evolving needs of the aging network. Go ahead, Caroline. Thank you. So back in 2022, the Nutrition Aging Resource Center conducted a needs assessment. And the results of that assessment suggested a need for more information about technology and software systems that are being used in delivering nutrition services and also for participants. But given the kind of inherent flexibilities in delivering OA nutrition services, we saw a lot of differences in how software is being used and everyone's specific experiences. And so, again, these conversations are a great opportunity to highlight that. So today we want to learn from a few subject matter experts how they're leveraging technology kind of at all levels within this network to modernize service delivery and data collection and management, increasing efficiency, building capacity and scaling up their operations, managing projects, and demonstrating impact and outcomes. And then we're hoping to take a little bit of time as a group to talk about your needs and opportunities and what you've already learned in evaluating, implementing, and using technology, and what some of those specific needs from the Resource Center might be. I want to mention that programs certainly are encouraged to collaborate with your own IT experts, state units on aging, area agencies on aging, local service providers, contracted partners, and other stakeholders as appropriate in evaluating your own software needs and solutions. And if you're looking for more information about software, including those mentioned today, you're encouraged to contact those organizations directly. I want to point out that the Nutrition Aging Resource Center doesn't endorse or recommend any specific software other than the reporting systems that we use for OA service delivery to ACL. So today's conversation is less about the specific software and more about some of those considerations, the benefits and challenges, kind of what we've learned and where we're going with technology. Go ahead, Caroline. So what do we mean by technology? This is such a broad term, and my poor team has to hear me talk all the time about using robots and drones in service delivery, and some things that I'm really fascinated by. We even see one of our assisted living communities here in Des Moines uses a robot in their dining room to serve residents. So some of you might also recall that the INNU group had a technology-focused conversation back in April of 2022. And I think we've linked to that at the end of today's presentation as well. You can find it out on the Resource Center YouTube page. But grantees on this call talked about how projects are using technology to reach both participants and providers through Zoom and text, using mobile apps to capture deliveries instead of doing it on paper, saving on data entry, helping to facilitate billing, paper assessments being done on Adobe Forms and using tablets, all of the work being done to kind of streamline those work processes and improve the security of the information that we're entrusted with. REDCap, which we'll talk a little bit about today, was also mentioned on that call. It's been used in academia for a long time, and how some of these platforms interface with each other and export that data. Programs talked about using Google Voice and all sorts of platforms that we can look at in this space. So if you're interested in hearing more, I'd encourage you to maybe go check out that conversation. It was also recorded. That was back in April of 2022. Go ahead, Caroline. Also wanted to touch on the why. You're all familiar with probably this slide and the growing population of older adults. So really, as these numbers increase, there's an even greater need for innovation in our programs to keep up and meet the needs of today and tomorrow. So we really want to use today's conversation to also highlight some of the spectacular work that you're doing in this area to do just that. Go ahead, Caroline. So with that, I'll introduce our panel. First, we have Janet Buls, who's the Director of Nutrition Services with Northeast Iowa Area Agency on Aging. Janet has delivered services to older persons for more than 20 years, starting as a livable communities coordinator and helping cities and towns develop into places where people can both grow up and grow old. She learned that trying to define an older person is neither easy nor necessary. Individual needs, wants, and wishes must be the starting point for services in this ever-changing environment, and that's okay. Being ready and able to adapt is one of her strengths. Janet has also been a fitness professional for more than 30 years, leading Tai Chi, yoga, as well as children and seniors fitness classes. Janet joins us today as a prior Innovations in Nutrition grantee who's been involved in the Iowa Cafe Restaurant Partnership Project to expand access and participation in congregate nutrition services in Iowa. Go ahead, Caroline. Amy Covington with the University of Utah is a research manager with the Department of Family and Preventive Medicine, University of Utah School of Medicine. She's been a co-investigator on 2 ACL INNU grants and is currently a co-investigator studying the interplay of malnutrition and the social determinants of health in older adults. Her research as a dietitian has focused on nutrition education and developing partnerships between medical and community programs to improve nutrition among community living older adults. Go ahead, Caroline. Michlene Myers has worked at Pinal-Gila Council for Senior Citizens, Area Agency on Aging, Region 5, located in Central Arizona for over 9 years. Miki has held various positions with the AAA in the provision of aging services and currently serves as contracts manager, overseeing contracted home and community-based services for the 2-county area. This includes nutrition services provided through 10 independent senior center sites. Miki works directly with nutrition providers to manage and improve data collection efficiency, most recently through the implementation of the Serve Tracker system. The implementation of this system has allowed participating sites to utilize the latest technology to develop the most efficient meal delivery routes, track client information, demographics, service utilization, and reconciliation. Next, Caroline. Last but not least, Leighanna Konetski is a registered dietitian nutritionist with the Colorado Department of Human Services, the state unit on aging. She's worked in the Aging Network over 20 years as both a provider of Older Americans Act nutrition services and as the RDN for the Colorado State Unit on Aging. So thank you so much for being here today and welcome to our panel. And with that, we will go ahead and ask our first question. So there are a lot of words on this slide, and it really boils down to essentially within this technology conversation, what is it that you're using? How did you get started and where are you going? So what was the problem that you were looking to solve? How did it lead you to a technology solution? How has it addressed that challenge or created some new opportunities? So I'll invite Miki to go ahead and come off mute. And in fact, all of our panel members can come off mute so we can move through this conversation to talk a little bit about the problem that you needed to solve, how you got started.
I think with our region, we're a very large region. I do cover 10 senior centers, and we were collecting data and reports and service utilization logs, basically, manually. They were sticks and stones, I call it, reporting to us. It was a very time-consuming situation. We really wanted to figure out a way and find a platform where it could be collected rather than them doing it manually. So in a more timely manner. Serve Tracker has done that for us. I can see reports in real time. I can see, what Senior Center A has, how many clients they served, how many meals they prepared. And then as far as the routing and drivers go, they were doing everything on you know, paper. Their routes were on paper. Now everything is on an iPad. You just click in, it shows you who to deliver to first. We can have a volunteer come in and pick up the iPad, and it's very easy and user friendly for them. So we really wanted to kind of streamline everything and have everything in one place rather than waiting for snail mail basically to get our reports in our units.
It's wonderful. And I think as we go through today's conversation, we'll have a chance to hear a little more about some of the challenges that come with transitioning from that sticks and stones approach that you're talking about. Janet, I'll invite you to share next a little bit about the problem that you needed to solve and where you're headed.
Are very rural. In some areas, we cover 18 counties, and we have some fairly large sized communities that we serve, but much of our territory is rural, and our congregate meal sites or our senior centers were losing attendance, and along came COVID. That just kind of made things even more complicated. We knew that we were going to try to provide meals at congregate settings for individuals who were in communities of maybe 1,000 people or 800 people or something like that. So we were looking for a way that we could track the meals at a restaurant without having to use papers, with our ability to track and document what was happening, as you said, Mikey, real time, and know what had happened. And so we were able to find a program that allowed us to give individual consumers a card or a key tag or something that had a unique identifier on it that an iPad or an iPhone would scan at the time of service, at the point of service. And that allowed us then to really limit or give that consumer a number of meals that they could have each month, each week, whatever we decided on. And then track those meals, see where they were being eaten, the time that they were being eaten, the days of the week that they were being eaten. And the other part of that was we really didn't feel like we could walk into a restaurant and ask them to handle paper vouchers or, let's make their world more difficult. And this really made it pretty simple for them we provided them with the actual hardware, an iPad, and they were able to scan those cards at the point of service, and it just made everybody's life a lot less complicated by doing that. So it was a really, really good solution, and the reports that we get on the back end are awesome. We're really able to see a lot of information from each individual as they go through. So it's been really, really a great system for us.
Wonderful, thank you. So yeah, looking at a couple of different examples of that data collection within the service delivery space. And then next I'll invite Amy to share a little bit about the problem that you were looking to solve and the solution.
Okay, so with our research, with the grant that we're doing, we are looking at malnutrition in older adults. And we all know that there's more that goes into malnutrition than just what you're eating, but there's also the social determinants of health. And so we really wanted to look at malnutrition and relate that to those social determinants of health. So we created a malnutrition comprehensive assessment that has those social determinants of health built in there, those questions. But once we finished creating that, it was very lengthy. And so to be able to collect that data and have the time to ask the screening questions, for depression or food accessibility, different things like that, it was going to take us a long time. So we definitely needed something electronic to speed up that process, as well as to be more accurate in our data collection. And so with the University of Utah, they have a clinical and translational science institute that supports research. And they house REDCap, which is an electronic data capture program. And with that program, we've been able to create our own assessment within there and are able to collect that data more quickly and more accurately with using that program. And so that's just made it so that we've been able to really look into the research that we wanted to look at and not have to leave anything out.
And I recall, Amy, you'd also shared with me kind of this natural partnership between, you know, the AAAs and the university on a project like this, and how, yeah, that technology really helps to solidify, I think, that partnership. Leighanna, so then from a state perspective, kind of looking at gathering that data kind of a different way, what is the problem that you needed to solve, and how did that lead you to your technology solution?
Sure. So probably like all states, we always have a lot of problems, a lot of things bubbling up. So just a few things that I want to highlight. We have seen a decline in volunteers, like most programs across the state, even pre-pandemic. And then, of course, the pandemic really exacerbated that situation, especially in our nutrition services. So long before the pandemic, our state unit on aging, we've always had the perspective of what we call leveling the playing field. And what we mean by that is all programs are held to the same standards, rules, regulations, regardless of the amount of funding they receive. And that's very difficult for our smaller, more rural programs to achieve sometimes. And so we view technology as an opportunity to level the field and continue to provide high quality services for all older citizens in our state. And through volunteer recruitment, so prior to the pandemic, we had a colleague who wrote a grant at our state unit to develop like a volunteer recruitment program for all area agencies on aging and older Americans Act services in our state. And we used something called Jot Form. And we had beautiful videos made. And so on our state website, we actually are recruiting volunteers for all area agencies on aging and older Americans Act programs across the state through the Jot Form platform, and it's worked brilliantly. And it helps us gather interested individuals and then connect them immediately to area agencies on aging, who then can figure out which service provider it would be a best match for, and then hand them off. So that's been a really great technology advancement we have. Something else that we wanted to do for leveling the playing field was really look at bringing outcomes and evaluation components to our nutrition education programming. With that, though, we know that not everybody likes to receive nutrition education in group settings. Everybody has a different way that they like to learn. We also wanted to make sure that we had cultural components to our nutrition education programming. And so in Colorado, it's very important that we have Spanish language programming that is culturally competent in serving our older adults who prefer to receive education or counseling in Spanish. And so we have a program that we call Text to Live Healthy. It's through mobile messaging, and it's a texting nutrition education program it's an evidence-based program through USDA. It's a partnership we have with SNAP, and it is done through that mobile messaging platform, and it's got an evaluation and outcomes component built into it. And so that's an opportunity for us to reach people all across the state with high quality nutrition ed in a platform method that they choose to receive it in, because not everybody wants to come to in-person education, or not everybody can commit to like long-term consecutive week programming. And so that's one. And then internally, we at the state unit, we had SAMs, we had peer plays for our data system, and we as Westerners struck out, and we have developed our own system on Salesforce. So we brought that internally and in-house into our state unit. We have Salesforce data administrators on staff now, and we are writing and building our own database to house all of our data so that we own our data, that we can mine our data and use our data in a way that makes the most sense for us, for our programs. And it really helps like our smaller, more rural programs, like I said, when we provide this type of tech out of our state unit to level the playing field, because they just don't have the resources that some of our larger AAAs do to deliver some of those services. So.
Go ahead, Caroline. So next, we want to look at what has really been the impact. Again, a lot of words on this slide, but what has really been the impact and how do you evaluate that? And I think we're looking for both pros and cons here from the panel. So we'll change up the order just a little bit because why not? And start this time with Amy in Utah. Can you tell us a little bit about the impact of using REDCap?
Yeah, so we have grown our area that we're covering, the senior centers that we're doing our research in. And with that, we've had to hire other dietitians to be part of our team. And having REDCap has just made that so much easier of a process because everything's in there. There's prompts within some of the questions to remind what information we actually are collecting in that space. It has automatic calculations built into it, so it'll automatically calculate BMI, calories, protein, and also the surveys, so our screening questions, so that we can quickly see a score and know if they scored at risk or not. Another thing that's been really great is we can consent electronically for the participant to be in our study. So we're not having to keep track of those consent forms under, lock and key because we're remote. We're in several different senior centers. And so having that technology is really, really useful. There's also an app so that if we're out of range, maybe one of the senior centers in a rural area, we aren't able to connect to Wi-Fi. We've got an app that's on our iPad that we can still collect all of the data the same and then just upload it once we get to somewhere that has Wi-Fi. The other great benefit for our project is we can download the stats and be able to have different ways of looking at that. And so that's really helpful in seeing the benefit or not, but hopefully benefit of our project. I can't think of a downside. I'm trying to think of a downside. I just think it's so nice to have technology. I think it helps us to be able to provide more one-on-one or be involved with the older adults and in their lives versus being so concerned of, oh, I've got to write this down or do this. The technology just streamlines so much that we can be more effective in what we're doing. And really our goal is to increase health and well-being in this population. And so I don't have a downside. I can't think of one, sorry.
No, I think that's okay. It's wonderful to hear you talk about how, people are able to really focus their time and energy on the project and the delivery of services and less time and energy on kind of putting together the data and having that managed for you. I'll invite Janet to talk a little bit next about, what the technology has meant for your project.
So when we started this process, we were looking at these restaurants to become Iowa cafes or congregate meal sites, and they were in kind of small communities in a lot of different areas. And originally, it was pretty popular right off the bat. So we distributed about 2,400 cards. So these little cards that were given to people were individuals who were eligible to participate in the congregate meal program at any one of these participating restaurants. And I believe right now, I think we have 10 operating. Well, yeah, 10 are going right now. And the technology allowed, we hired one person whose primary responsibilities is the Iowa Cafe program. And we could not have done anything like this without this technology. There is just absolutely no way. We can also get an awful lot of really interesting reports out of the program. So I can see on average, and this is, go clear back and ask requests from the very first month that we used the program. How many meals did each individual have? So 76% of the consumers were only using 1 or 2 meals a month. And that's pretty interesting when you think about what is the reason for your program? Why are you doing this? What are your goals? Are you trying to improve nutrition for individuals? Are you trying to kind of help them with their social isolation? 1 or 2 meals a month, I don't know if we're doing what we really want to do with that program. So it just allows us to really look at what our intention was. Can we actually, can we make some changes in it that make more sense to try to meet our outcomes and make it work? As far as the capacity, building capacity and the efficiency, again, just we could not have done it without this sort of technology that allowed us to do it. Downside, I'm kind of like you, Amy. I can't really think of a huge downside economically. This particular program was really reasonable for us to do. Each time an individual has their card scanned, it's 20 cents. And so you can have 100 people eating at a meal site in a month's time, but the amount of time it would take for a staff person to go and do some of that data collection would be a lot more than what we pay for 20 cents a scan. So the return on investment there, it's absolutely worth it for us. We are also using it as an opportunity to serve the consumer right there, their nutrition ed. There's, we have more QR codes that people are using on their phones. They're becoming a little more comfortable with the technology. And I think that's a big deal. If we can get individuals who are not so concerned about being scammed or the phishing attempts that are happening out there and get them to understand that we're a good thing. I think that's important because that was one of the barriers that we had to overcome with technology with some of our older consumers. They have been taught to be afraid of technology, and anything that appeared there for them to use, either the phone or a computer, they were very hesitant to do so.
Thank you. Mikey, how about the impact of your project so far? How has ServeTracker impacted your program?
I think along the same lines as Janet, it's really allowed us to build that technology information with our consumers, as well as our sites. It's improved our data collection process, reducing the margin of errors and, somebody perhaps missing a registration because they're shuffling through 50 pieces of paper to decide how many people ate. Just really in general, allowing us to use the data to tell our story and to give us program outcomes. The reporting is phenomenal on our pro system as well. I just had to run a report yesterday to say how many people did we feed last year? How many units of service did we provide? How many clients did we serve last year? So it's really helped to pull those reports and track what we're truly doing and what our goal is, opposed to having to go to a 3-ring binder or a spreadsheet or multiple spreadsheets. And I too really don't have any negative to say with the technology aspect.
Yeah, so kind of that common theme emerging of efficient data collection and effective evaluation and reporting. Leighanna, how about from Colorado?
Sure. So, and I have some barriers I'll share at the end too, because it's been growing pains, right, when you do new things. But for us, I mean, just even looking at all of the different systems that we're doing, what we're hopeful and what we are seeing is efficiencies that are being built. And like for the volunteer jot form system that we have set up, what that does is it allows us to reach in. It's a very young demographic that we're reaching. All of our volunteer interest is actually coming through Google. And we might get 25, 30 at least volunteer interest individuals coming in through that platform every single month. But what that has created is a new avenue of recruitment and engagement. So it's a wonderful opportunity for us also to reach a totally different demographic for volunteers. But what that has also done is it's created pain point for our AAAs because they had to develop processes to do volunteer retention, recruitment, the engagement, because when you have volunteers coming in, there's only so much time where you have to touch them, connect them, and plug them into what they're wanting to do, or you could lose their interest. And so that was one of the barriers we had, is that our AAAs were not used to being volunteer clearinghouses, so to speak. They were not used to doing volunteer management. And so they all had to build internal processes on how to manage that well. And it's working, but there's growing pains for that. And then new systems, because this was an entirely new channel for volunteer recruitment. And it's not through United Way, it's not through other organizations. So they had to develop new mechanisms and actually have staff take on additional roles, because when they come through our Jot Forum platform, that individual is immediately connected to the state unit and immediately connected to the appropriate AAA and immediately sent replies of thank yous and stuff. So it's a seamless process. But then we have a provider entity sitting out there based on the interest that the AAA is having to coordinate with and figure out for matching. And so there is growth there, and a lot of like new skill sets and new staffing coming in, trying to figure out how to manage that. And the same thing with our texting program. It is an awesome opportunity to have our dietitians spend more time on nutrition counseling instead of recreating nutrition education at the local level. So this program, because it has outcomes, it has outcomes with logic model and behavior change built into it with an evaluation component to it. It allows our dietitians to spend more time on nutrition counseling. And so it's a way for us to bring high quality programming in English and Spanish languages and culturally appropriate programming across the entire state. Because a lot of our programs, they don't have the funding to be able to do high quality programming that we require in nutrition ed. So this helps bring that to them. But one of the barriers we have seen is that not all older adults want to receive health and information via text. So the audience is more limited. But those that do participate, and it's a 3-year program, and it has local messaging components. It's a whole beast that I won't get into the weeds on. But those that do participate absolutely love to receive information that way, and they self-select to join. But somebody mentioned, like, I think it was you, Janet, the hesitation sometimes of like scanning QR codes, texting in keywords. What does that look like? And just there's a lot of tech information that in education that is happening around that program. And as we saw through the pandemic, where many restaurants moved to QR code scanning, and just the pandemic really quickened the pace, I think, in some sense, with technology changes. And so we were excited to bring that program in, and it's been great. But there have been challenges because it's not for everybody.
Yeah, we definitely see this sort of spectrum of individuals, those who are, as you say, either really drawn in by the technology. That I think it was a CBS article that's linked at the beginning of today's presentation, talks about how, some people come in to see it just for the novelty of seeing this new thing. And I think, any sort of technology, sometimes may have that same kind of appeal, with certain populations. But as you say, certainly not for everyone. And so there may be some opportunity to have some conversation, hopefully either today or in another conversation about, some more creative ways that programs are working to overcome some of that. Because as much as we saw that expansion of technology, like you say, through the pandemic, we do still see those challenges and barriers. Those are definitely ongoing. Okay, next, Caroline. So last, as we look at, kind of where the Aging Nutrition Network takes this, I was hoping we'd have a little bit of conversation about some of the lessons learned and where our panel sees opportunities for the Aging Nutrition Network in leveraging technology. So, Leighanna, you talked a little bit, we'll change the order up a little bit now and start with Colorado. You talked a little bit about leveling the playing field. Could you maybe expand on that just a little bit? I think that kind of really speaks to this question.
Sure. So In Colorado, and I know all states feel this, that we provide funding in varying levels because of interstate funding formulas. And yet we require the exact same rules, regulations, and policies to be met of all programs, regardless of the amount of funding that they receive. And often we see our rural areas receiving less funding because the interstate funding formula is primarily based on population. Yet they have significant increases in wind chill time and space of which they're trying to serve. They have less opportunity to access resources. They may be the only shop in that entire 6, 7, 8 county area that touch points on aging. And there may be not even enough providers to provide all services. And yet we hold them to the same standard. And so we view technology in our state, especially in nutrition services, as an opportunity to level the playing field and ensure we have high quality access to services for all citizens, regardless of where they live. And so when we're targeting older adults in communities of color, low income older adults, and rural older adults, sometimes those are the exact areas that don't receive the funding necessary in some instances to do as much service delivery, as much volume, have as much services available or different types of programs. And so when we look at technology as an opportunity to level the playing field, and we do that from the state, we bring those resources in from the state so that the local regions and agencies benefit from those resources, but don't have to spend their limited funding on them. And so that's how we see it as a leveling of playing field. And it gives an opportunity for those small programs to still have access to high quality nutrition education, to still have access to volunteer recruitment systems, to still have access to like our Salesforce data system. I didn't talk much about our food processor system or like our huge analysis system that's statewide, but anything that we can do to level the playing field and not leave behind our small rural areas, but still serve them with just as high quality of programming as our urban areas. We do that as best we can through technology.
Any final words of wisdom or something you wish you'd known before starting?
I think the one thing that I would always recommend is that you're in it for the long game and you have to have a long range view, because it is so stressful at times when you're bringing in new tech and you're changing things up and you're doing new systems. And so you have to have a long range view, and you have to get your teams acclimated to the fact that in the long run, this is the way we need to go. And so constantly strategically looking long term.
Thank you for that. I'll turn next to Amy. Any words of wisdom?
Yeah, so first thing that I found out that I didn't know ahead of time with, at least with our our technology, the red cap that we're using, is they will take what we create and put it into the digital form, but they also will just do free training. And so some of that we can do ourselves. And so that saves on cost. And so that was interesting to me. I didn't know that that was an option. And so I thought that's something great to know if, if someone's concerned with the cost of the technology, look to see, if it can be self-run, how much you can do yourself and save on that. But better leveraging, with organizations and technology. One of the things that I've seen just working with the area agencies on aging and, which is where our Meals on Wheels is housed and our congregate sites, people or older adults that are on Meals on Wheels do nutrition screenings every, I think it's 6 months. So at least twice a year, they're being screened for malnutrition. We're now in the congregate site, and that doesn't typically happen, or very rarely that they're being screened for malnutrition. And what the research shows is that older adults, 50% of older adults are either at risk for malnutrition or they're already malnourished when they go to the hospital. And so malnutrition in the community is a huge problem. And with, just seeing how easy this technology has become and how quick we can collect information, I've thought it'd be really great to have just a simple electronic, maybe an iPad at each of the senior centers that asks the few nutrition screening questions, and it calculates, the risk. And if they're high risk, then collaborating with dietitians who can now provide them nutrition counseling versus just nutrition education, that they can meet one-on-one and really get on top of that malnutrition before it becomes such a huge problem. And so I think technology is really paving a pathway for us to be able to connect community dwelling older adults with services that are going to help with their, keeping them functional, keeping them out of the hospital, being able to fight off illnesses better. And so I think it's a great thing to think about and look at within the area agencies on aging and looking at nutrition and malnutrition risk.
Yeah, I love that idea as we learn more and more about how these organizations can work together to help to reduce and address those risks or that risk. Janet, I'll turn next to you.
I think this is a really interesting question because I didn't know what I didn't know. As we started the process, hey, this will be great. This is lovely. This is fine. Let's just do this. And as time went on, I don't know that I've ever even mentioned Senior Dine is the program that we work with. And we got to be really good friends with our technology advisor consultant, John, there. And the number of times we would send him an email, hey, can we do this? He'd come immediately back. Yep, just give me we'll get that done for you. And so lots of information. Think about what you might want to do with that program, even if it's, a dream and pie in the sky kind of thing. Can this be done? Because I don't think the way computer software people think at all. And they know how to do stuff. And so we learned in a hurry that don't try to do it manually yourself with what you have. No. Call the folks that are involved in your program and ask them, because you just don't know. You can't even begin to ask all the questions that you think you might want to have until you're into whatever program you're doing. And then you say, oh, I wish we could gather this piece of information, or I wish. So for instance, these 2,400 people were all given a code, their card, and they were out there floating around. But we found out that people thought that was just so great and wonderful, and they wanted to be involved in the program, but then they didn't use the card. And here we were 6 months, 8 months, and they hadn't ever been to one of our Iowa cafes, our restaurants. They hadn't been in and used them. So, the fiscal department's getting kind of anxious because technically that is a liability. They could at any point go in and use, at that time, 12 meals a month. And so we would have, 2,400 people, well, not at once, I guess, but 1,200 people eating 12 meals that we weren't, it wasn't happening, but it could. So we just decided, well, maybe we could deactivate their cards. And if they go to try and use them, they'll call us and we could reactivate them and do an updated intake on them and do that nutrition risk screening tool and all that. Well, that's a lot of people one by one. Nope. We just called our technology at Senior Dine, and no, you just have to send me a spreadsheet, which we had. And bam, he did it in like minutes. He would send back and say, oh, they're all deactivated. So, just spend a little bit of time brainstorming, thinking, your pie in the sky wishes, because ask those questions when you're evaluating whether or not this is the right program for you, because you just don't know what you don't know. So I guess that's my words of wisdom.
Yeah, that's important. Finding out, early on what you can expect in terms of that support. And, Amy talked about the training. That is a tremendous consideration. So I appreciate you bringing that up. Mikey, I know you haven't had as much time to think about this, but wanted to offer you an opportunity too. What, any words of wisdom for this group?
I think just the problems that we ran into were the reluctancy on the provider, the directors, not wanting to be technical savvy and getting them the training, Also, we too have very rural senior center sites. And what I've come across is some of them just don't have the bandwidth or the Wi-Fi capacity to support the Serve Tracker system. We have a kiosk that we put into our congregate site, so the consumers can go in, they can, register for their meals weekly, and we do make them re-register annually so that we're getting that nutrition screening on our congregate participants on an annual basis. Home delivered meals, of course, is every 6 months. It was a very time consuming process, and we're not even halfway done. So we've learned a lot along the way.
Yeah, and that's real, kind of taking that same, those same points we just brought up and kind of turning it internally, to look at that, that buy-in and training and support that'll be necessary to have a successful project. Well, with that, I want to say thank you so much to our panel. And Caroline, I'll invite you to advance to the next slide. Now we'd like to open it up to the rest of you to talk a little bit about, your technology needs, what opportunities you see going forward for the, within this space, or questions that you have for our panel today. Feel free to come off mute or drop it in the chat.
I can tell you one thing we discovered along the way. One comment is that our rural people are not tech savvy at all. And in our project, now I'm speaking for my boss and everybody, and so I'm not the expert, but I know they designed a program where you turn on the iPad and there's just icons, to talk to them, to do an exercise program, or to have food delivered. I mean, just simple, simple, simple. And yet our people in the rural areas, some of them can't read, they can't see, they can't hear. They are just so far from city life at all. And I'm being as broad as I can, but you need to consider those things too, because there'll be challenges, and you have to call them to remember to plug it in, because we can call them on it or they can call us, but they have to remember to plug it in. They may or may not even have a telephone. So, I mean, those are some challenges. And I thought that was important to mention, because it's surprising that we thought it was so simple. You turn it on, you press a button, but even that is hard for some people. So we have learned a lot along the way. It's like, you can't know till you try, right?
So what works? What have you found does help? And I'd open this up to the rest of the group, because I know that's not a challenge that you alone are dealing with.
I don't want to speak out of turn too, because I mean, as we go along, this is developing. I believe that students or members of our team will work with these people one-on-one. So they have it written instructions, but they can't read, or with pictures to show you, plug it in, so it'll charge and then you can use it. So I'm not sure what works. I'll find out in our meeting next week. Because I'm not out in the field or anything. I am the paper shuffler. So that's why I hesitate to say anything, but you need to be aware that people are uneducated. They can't hear, they can't see, and it's like, so these are, like sharecroppers. They're so far removed from our lives. But that's just what I've seen, so that's my opinion. Please consider those things.
Bambi, can I jump in there? This is Leighanna. I just
Please.
want to say, I think we have an obligation to continually bring technology to our older adults. And we have an obligation to not leave them behind. And so there are always going to be barriers. We're always going to find challenges, but I think it is still so important that we invest in that regardless of where they live, regardless of their backgrounds, because if we do not do that as part of our advocacy work, they are going to be left behind on all fronts. And so while it may be challenging and it may be difficult and we can never meet the need of everyone, I think we have an obligation to continue to do that and have that long range view and assist, because it's not just our programs for access with technology. We're talking about home and community-based services programs, Medicaid, Medicare, open enrollment. And so there are always going to be difficulties, and that's where I think community engagement comes in. And individuals that know those communities best are the ones that should have the rapport to help with that introduction. But I just wanted to add that we have that obligation, I think.
I'd like to second that, Bambi, real quick, because long range. So this is true story. I don't know if any of you have ever seen The Big Bang Theory. It's a kind of a staple in our home, and it's been gone off TV for a long time, but we watch the reruns. And there was an episode where one of the main characters creates a virtual reality of himself because he's afraid of getting hurt. So he has a monitor on a little cart, and he puts a t-shirt hanging, and he has a little, motor that this is him, a virtual him, Sheldon, so that he can stay in his bed and he goes to work and he does all these crazy things. So my husband was in the hospital 2 weeks ago, and in comes the virtual doctor to see him. There's a med tech pushing him in, and it just cracked me up because here it was, The Big Bang Theory's Sheldon, virtual person. And 13, 15 years ago when that was on TV, it was hilarious. Nobody, it's not going to happen. It's never, that's just a silly thing for a TV show, but it's very much real. So, we push those people who are ready to learn today. You're never going to reach everybody. There's just going to be a certain group, paper and pencil won't help people who can't read. You're still going to have a person go in there and help them do some of that stuff. But I think personally that if you're 75 years old and you're using a smartphone for anything, which we know people are, they're going to be ready for more technology over the next 5 or 6 years. The 85-year-olds in 10 years are going to be able to do a lot more than the 85-year-olds today are, because they're going to be so much more comfortable with technology. So we just have to embrace it, I think.
Yeah, it's definitely changing quickly. Okay, in our last minute, Caroline, if you could please advance the slide. I think we just wanted to leave you with some additional resources. And so, if the need going forward for this group is to have some more discussion around those participant-facing technology projects, that's something that we would love to hear. And there are some resources on this list that hopefully will help with that. That conversation that we had back in April of last year that I mentioned is linked here as well as some resources that we have posted on the Nutrition Aging Resource Center. So I'd invite you to check these out and then let us know what your specific needs and questions around technology are, so that we can start to plan hopefully some resources to support those efforts. So with that, I just want to go ahead, Caroline. I just want to thank our panel again so much for your participation today. And, it's really great to be able to kind of bring this group together. And I think that there will be lots more opportunities to talk about what's happening in this space. So thank you so much.
Thank you so much, Bambi. Appreciate it. Okay, well, we're at time. So thank you so much for everybody's time, and hope you have a great rest of the week, and we'll be in touch soon. Take care.
Thank you.
Thank you.
Bye-bye.